Hello, my name is Jahnvi UG. I'm a final year BDS student from Bharati Vidyapeeth Dental College and Hospital, Pune. My topic today for poster presentation is salivary diagnosis of COVID-19. The COVID-19 pandemic has been a challenge and a global health crisis. In such a situation, it is imperative to have methods for rapid and accurate diagnosis of the affected to contain and prevent further spread of the disease. Since saliva can host the virus, the chances of transmission of the virus through saliva become very hard to avoid, especially in dental practitioners. Thus, proper management for it is a must. The clinical symptoms of COVID-19 are cough, fever, shortness of breath, myalgia, sore throat, chest pain, rhinorrhea, etc. Some patients may also suffer from gastrointestinal complications, advanced respiratory complications in the most severe phases of the disease. The current methods of testing involve three categories of testing: the RT-PCR, which is the reverse transcriptase polymerase chain reaction test, which essentially tests for the genetic material of the virus, that is the RNA of the virus. Second, the rapid antigen test, which tests for the antigen of the virus. And third, being the antibody test, which tests whether the host has developed antibodies against the antigen of the virus. For the former two, swab samples are required. These swab samples can be nasal swabs, nasopharyngeal or oropharyngeal swabs, sputum samples, and salivary swabs. Nasopharyngeal and oropharyngeal swabs are recommended for the testing of COVID-19. The transmission of this disease can be direct, like through a sneeze, a cough, or droplet inhalation. And it can also be contact transmission, like ocular contact through saliva or mucous membranes of the nose and eyes. Saliva is an exocrine hypotonic secretion produced from the salivary glands. There are three main pairs of major salivary glands: the parotid, the submandibular, and the sublingual glands. Several other minor salivary glands are also present at the oral cavity. Saliva has various functions, including cleansing of the oral cavity, antimicrobial action, and it also aids in digestion. Due to the rapid development in the field of medicine, it is now well known that saliva is a pool of biomarkers. This may be due to the high permeability of the salivary glands and the abundant blood vessels and capillaries present around the glands. Hence, the biomarkers in the circulation can infiltrate acini and ultimately be secreted into the saliva. This makes it an excellent option as a diagnostic fluid. After reviewing and collecting information from several articles, it is concluded that nasopharyngeal and oropharyngeal swab samples, the procedure required is invasive, causes a lot of discomfort, thus cannot be repeated within a short period, which may be a necessity in certain situations for the sequential monitoring of viral load. The procedure also may sometimes cause bleeding, most probably in patients with thrombocytopenia. It requires close proximity between the healthcare worker taking the sample and the patient, which is unsafe and poses a risk of transmission. For mass testing, a large number of healthcare professionals are required, making nasopharyngeal and oropharyngeal swab testing an economic and logistic burden on the healthcare system. On the other hand, salivary swab samples can easily be taken and offer several advantages over nasopharyngeal and oropharyngeal swab sample methods. The process is rapid, non-invasive, non-painful, does not cause any discomfort. It is safer and reduces the risk of cross-contamination. It can also be repeated and multiple samples can be taken at once simply by asking the patient to spit in sterile bottles. Also, no medical professionals are required for this. Saliva does not clot like blood, thus can be manipulated more easily than blood. Whole saliva taken from the mouth is a mixture of glandular secretions: crevicular fluid, serum, digestive and protective proteins. Despite the heterogeneous nature, this mixture is a great potential diagnostic fluid. Salivary screening has been previously used among hospital patients for screening of respiratory viruses. The SARS-CoV-2, commonly referred to as the coronavirus, can be detected in saliva in high titers. SARS-CoV-2 has at least three separate routes to present in saliva. The virus in the lower and upper respiratory tract reaches the oral cavity along with the liquid droplets. The virus in the blood may enter the mouth through the gingival crevicular fluid, and major and minor infection of the salivary glands ensures release of particles into the saliva through the salivary ducts. In studies reviewed, an overall result observed was that 70 to 80% of the infected patients tested positive through salivary swabbing. However, a firm conclusion will require formal and official diagnostic tests. If more research, which is required to analyze the potential of saliva as a diagnostic fluid, is done, it may be pivotal to successfully develop methods to use saliva for rapid testing and also for chest side diagnosis. Thank you.